and then rocking that into place, looking at the patient's face and making sure that we're getting the right angle on that. She comes in with her LED light. That's the Ultra Lume from Ultradent. It's got several different lights, so it can cure several different photo initiators regardless of what bonding agent or composites you're using. And pop that one off. And like I said, these four aren't going to be exactly how we want the crowns to be, but I like the fact that they're too long so we can cut them back. So if we take really short teeth like we have here and we're trying to end up at 10 millimeters, we have more than enough to be able to do it. I find that I get very dense fills, so as you see me prepping on the incisal edges here, you won't see a lot of voids or air bubbles in the buildup itself, and that's nice. When I used to do it by hand and kind of stack it up, I would kind of incorporate that and have voids and other little bits of noise that would show up in the buildup as well. So I do like being able to take one of those crown forms, squirt everything in, get a nice solid mash, put it down over the fiber post in this case, and then be able to cure that and know that we're going to have a nice solid mass. Now, if you've seen any of our presentations before, you'll notice that I'm prepping a little bit more aggressively in the area of the gingiva than I typically do, and that's because I know I'm not taking the impression today. That's the Biotemp stent that we just put into place. That shows me how much reduction I need on these preparations to get the Biotemps into place, and those are the Biotemps in place. And here are the Biotemps 2 weeks later. So we're going to take those off and see how our tissue looks. And we're beginning this appointment by packing our double zero cord in place. So we're going around the tooth with our double zero cord. We'll do that to all four of the teeth, and then we're going to place the two cord on top of that as part of our two cord technique. And we're going to go around all four of the teeth and make sure that nothing is exposed except for the end of that two cord. These are comper caps from Coltine Whale Dent. These are little miracle workers when you have the patient bite down on these for 8 to 10 minutes, and then we remove them. You can wet the gingival third of those if you prefer to, if you feel like they might stick to the tissue and you don't want to cause bleeding, and then we remove the four number 2 cords from around those four preps, and from the cuspid next to it I inject a medium body material around the preparations, and we have heavy body material in the tray. Put the impression in. Wait 3 minutes, take it out, and hopefully we've got a nice looking impression when we take a peek at that and see what it's going to look like. Now we put the same temporaries back on that we relined and placed at the first appointment, so we know that the tissue has not moved at all. So we're pretty confident when we try in these final restorations that the tissue levels are going to be exactly where we need to be, because we've had the temporaries on for 1 2-week period already, and now they've been on again for a second 2-week period. When you impress the same day that you prepare, it's always a little bit of a crapshoot whether or not your temporaries are going to affect the final position of the tissue and whether or not you'll end up with any exposed margins. And you can see those preps are now normal length, where we've got our just a little bit shorter than that because she's not a big woman and we really didn't need 10.5 millimeter central incisor length. We're at just about 10 millimeters, and our centrals are a little less. So we've got nice preparations that are about 8 millimeters long. And the reason we want 8 millimeter long central incisor preps is because the final length of these crowns are going to be 10 millimeters in central incisor length, and that accounts for our 2 millimeters of incisal edge reduction. So once we place that buildup material and start to prep it back, it's not as haphazard as it may seem. We have a definite number in mind when we're preparing that back, because we start every aesthetic case, with the end in mind, where we want to end up. Now that those 4 lava crowns are in place, we're using a Prophy cup and some pumice to clean the adjacent teeth. We're going to place some V-veneer, no prep veneers here. And, this has just turned out for me to be a great way to finish off smiles. These teeth are virgin teeth that we're going to here. I would not feel right going in there and preparing them for lava crowns to match these other ones. Even preparing them for veneers now seems like overkill with these thin press, no prep veneers that we have today. And we're able to press these to 0.3 millimeters. So we're talking very, very thin. In fact, at the end of this presentation, we'll take a look at this case from the occlusal view, and you'll get to see, how thin these veneers can be, because I don't touch them once they go into place. And they're simple to place. We simply etch the enamel for 15 seconds, rinse it off, place the bonding agent, cure it, and these are the V-veneers going into place. If you don't recognize that, that is Ivoclar's veneer cement, and that is the shade medium or translucent, or clear, might be the easier way to call it. They call it medium shade, but it's just a clear cement. And it keeps the veneers from looking too opaque. I don't like to use real opaque cements, although on most of these, by the time you place the veneer, the cement layer is so thin that it almost wouldn't matter what color you use. But just in case you end up with an exposed margin or some cement, the clear cement I find is a little more stealth than some of the other colors. This is the serrated strip from Axis Dental. If you told me that I could never use one of these again, I doubt I'd ever bond another restoration into place. I would cement everything. They are perfect for reopening contacts between teeth. And then some thick glide floss is being used to go in there and remove any pieces of cured cement that are still there. You know, I find that with these no-prep veneers, there's no need to clean in between the teeth until you use that serrated strip. Some guys hold it down and want to floss through there. I find they move too much. I just cure them into place and then use that serrated strip to clean everything out that I couldn't get to with an Explorer. The brownie wheel is used to clean any cured cement off the teeth, and here's the greenie wheel being used after that. And these two instruments were usually for a cast gold technique, but here they're being used on porcelain. And you can see on both sides of the mouth we've placed no prep veneers in there. So lava crowns on 7, 8, 9, and 10, and the cuspids and first and second bicuspids on both sides have that. And take a look at that. Look how thin those no prep veneers are on those bicuspids and the one cuspid. So yes, it makes the teeth 0.3 millimeters thicker, but it really rounds out that smile and gives the patient a nice broad arch. So when they smile, you kind of see that wall-to-wall teeth look. And that's the goal of most orthodontics, is to take a patient with a narrow arch and give them a nice wide arch, and that's one of the things we're able to accomplish with no-prep veneers. My favorite thing about the no-prep veneers is how conservative they are. We have another clinical presentation on our website that shows me taking off some no-prep veneers with my water lace from BioLase, my YSGG laser. And you can actually pop these things off with a laser without having to take a burr to tooth. So I don't tell patients they are removable, but I know in the back of my mind they are, just in case something happens. So I love these no-prep veneers as a great way to kind of match shades within an arch, and a great way to take care of little problems on other teeth that don't require preparation. They certainly don't require a crown, and I find myself not wanting to even prep a veneer on them if I don't have to, because I can put a no-prep veneer on, keep it pretty darn conservative, pretty thin, and if I have to, pop it off with the laser, polish off the composite cement, and be back down to the virgin tooth again. On behalf of all of us here at Glidewell Laboratories, I'd like to thank you for your time today, and thank you for your commitment to quality dentistry.